Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the vlog post. A common question that many newly diagnosed cancer patients ask: what happens if I refuse chemotherapy? What are my options? Well, first and foremost, certainly the answer to this question depends largely on your goals, your cancer, the type of cancer you're diagnosed with, and your stage. As an example, early breast cancer, some people argue that it's not cancer at all, is something called DCIS, or breast cancer stage 0. Some people advocate for no treatment. Some people, no chemotherapy certainly. Some people advocate for simply minor surgery, something called a lumpectomy. All I'm saying is that the stage of the diagnosis has a lot to do with the answer to this question. Having said that, the longer answer is that, in my experience, your options are all about risk. Chemotherapy, in general, on average, reduces the risk of relapse. So, for example, it's common to surgically remove a tumor. That reduces the risk of the cancer growing. You're debulking the cancer. Chemotherapy then, in effect, kills more of the cancer. That reduces your risk further. There are other risks. Toxicity can sometimes lead to problems. So when I say risk, I mean pros and cons, risks and benefits of treatment or no treatment. So, in essence, to summarize, what happens if I don't undergo chemotherapy? And let's be clear, there are lots of patients who are nervous or afraid of chemotherapy because there are negative side effects on occasion to chemo. The chances are, and this comes from a guy who studied cancer for more than 30 years, chemotherapy can reduce the risks of the cancer growing more, whether it's reducing the risks short-term for 1 to 5 years or longer. Depends a lot, again, on the stage and the type of cancer, how much chemo you undergo, what chemo you undergo. That's, again, a longer answer. But in general, chemo reduces the risk of the cancer growing. Surgery reduces the risk because you remove a bunch of bad cancer cells. Radiation kills cancer cells. That's, in effect, why patients undergo treatment of any kind, to reduce the risks of the cancer growing further. If you have any questions or comments, scroll down, click through to the blog post, and let me know. No question too big, too small. I answer all questions. In the meantime, thank you for your time. Hang in there, and good luck.